go. Hi, and welcome back to Heart Health with Michelle. Today, we're going to be talking about the primary prevention of heart disease. So when you go to the doctor's office, what are we looking for in order to reduce your risk of heart disease, heart attacks, and strokes? I'm so excited to invite our special guest today, Dr. Sanul Corrielus, to talk about this with you guys today. Without further ado, I'd love for Dr. Corrielus to introduce himself, a little background about who you are, and then we'll begin our conversation.
Fantastic. Thank you, Michelle, for having me. It is indeed a pleasure. I always love talking about the heart. That's what I do. I'm a board-certified cardiologist. I'm the CEO of Corrielus Cardiology. Here in Philadelphia, we are providing heart health to the community at large. And so we'll delve right into it.
I love it. Thank you so much for being here with us. So talk to us about, okay, a person comes into your office, right? They're going for an annual physical. Do they usually come because there's a symptom, or is it more of, I want to prevent anything from happening?
Very great question, Michelle. And I wish it was that they will come for prevention, right? But more often than not, what we see is that people are coming in because they have the symptoms. A lot of times, I think that we, as medical professions, may not be doing as much of our work in terms of really raising awareness about heart disease and heart health in general, so that people can start being more proactive and seek to get the heart health, or at least find out about the status of the heart health before they start developing symptoms. But more often than not, they'll come in with symptoms. A lot of it, is chest pain, or they could be having palpitations, or they're feeling fatigue, or they're just low energy. And so we do know that, the heart being a pump, a lot of times, as if the pump is failing, one of the things that they're going to experience is the lack of energy. And so that's how they normally present, in addition to the chest pain.
Right. And so when someone comes in with these chest pains, with anything, I think to take one step back. So we're talking about primary prevention, which means before you have a cardiovascular event like a heart attack or stroke, we want to make sure we're taking all of the preventative measures. And so let's kind of deep dive into, well, what preventative measures should we be asking our physicians? In my practice, a lot of times people are saying that, I didn't know what to ask my physician. And my physician kind of took all of these tests, but didn't tell me about them. And how do we get people to be more proactive in their health when they're at that annual physical that they're going to?
Great. I mean, first place I like people to start is understanding their vital signs, right? Vital signs. When you go to a doctor, any doctor you go to, that's the first place they start. They can take vital signs. And what's included in the vital signs? It's most importantly your pulse and your blood pressure, in addition to your weight and height, which gives you your BMI. So if we focus on those three, right? Your pulse, your blood pressure, and your BMI. Those will give you very vital information to understand where you are in terms of how you can start taking steps necessary to be more proactive about your heart health in general. So let's start with the pulse. The pulse should really be, if you're sitting, resting, should be 60 to less than 100, okay? It depends on how excited you are, then it can go above 100. After exercise, you're definitely above 100, right? But for the most part, if you're sitting calmly, watching a movie and whatnot, your pulse should not be 90s going into 100. Why is your heart going so fast? You should be in the slow lane at that point, not on the fast lane, right?
Yes.
So that's one thing that tells you, okay, something is going on here. I need to know, why is my heart racing? Why is my heart going so fast? Okay. Blood pressure is another thing and that you get in the vital signs. Where is your blood pressure? What is your blood pressure doing? Is it in the normal range or is it high? So we have had most recently different definitions of what normal blood pressure looks like. That's a little bit more stringent. In essence, we're trying to be more on the side of catching people who are pre-hypertensive, where we say anything above 120, the systolic. When you talk about blood pressure, you have the systolic number and the diastolic number, the top number and the bottom number. If the top number is above 120, especially if you're in the 130s, you considered pre-hypertensive. And at this point, you need to start thinking about, okay, what do I need to do to keep it lower? What am I doing that's keeping it, elevated? And the bottom number should be less than 90, okay? 80 preferably. And your BMI is the last point that I mentioned in the vital signs. Your BMI should be in the 20s, right? I mean, if you're talking about, the BMI is really your weight based on your height. And a good number is late 20s. But if you're in the 30s and up, you in the obese, overweight and obesity range. And those are great markers to tell you, hey, I need to start being more proactive. I need to start having a plan with my doctor about, okay, what I'm going to do to get in the normal range. And so I say that's a great place to start especially during the annual physical exam.
Yeah, so a couple of things. So BMI alone is not going to tell us where the excess weight is located. I've seen a lot of people actually have a normal BMI, but they have an increased waist circumference. And if you have an increased waist circumference, we know that that abdominal weight that's surrounding your visceral organ is more metabolically active, meaning it's going to brew more inflammation. And when it comes to cardiovascular disease, inflammation is what causes that plaque to form in the arteries and can cause a cardiovascular event like a heart attack. So it's important that we also measure the waist circumference and let that guide us. I find a lot of times people go to the doctor and they're like, oh, well, if you just lose weight, your blood pressure will come down, your cholesterol will come down. And while some of that may be true for some individuals, heart disease doesn't discriminate on weight and on size. So I'm very particular about saying, we need to make sure that if weight loss is a goal of yours from a risk disease standpoint of risk reduction of disease, we need to look at it from a nutrient sufficient way versus a caloric restriction way, because it could negatively impact your blood pressure and cholesterol if you're just told lose weight and people try doing it the fastest way and it's not sustainable, and it can cause actually an elevation in blood pressure and in heart rate when it's too fast. So we need to be just mindful of that. The second thing I like to ask you, because you mentioned pulse and heart and high blood pressure, is many people feel that they get anxious, white coat syndrome. They get anxious in the doctor's office. And so they know their blood pressure or their pulse is going to be high because they're in front of a doctor and it's very nerve-wracking. So how do we address anxiety around being in the doctor's office if we are known to have white coat syndrome? That's one question. And the second thing that I really want to stress upon is we need to be checking blood pressure outside the doctor's office as well, because one-time snapshot of your blood pressure is not going to give us a good idea of your blood flow and how your heart is working. And so if you have white coat syndrome or it's higher than 120/80 in the doctor's office, we should be investing in checking that value again in the home.
Absolutely. There is such thing as hypertension, stress-induced hypertension, okay? In the environment that you're in, then you're more susceptible to having high blood pressure, right? So in the normal setting, stressful setting, acutely, having a high blood pressure in response to an acute stress is actually good. It's actually good for you in the acute setting, right? But when you have repeatedly exposure to stress and you have a high blood pressure response to that stress, then it's no longer healthy. You mentioned inflammation. Inflammation is really the driving force behind that, because we have all these hormones that are driving the inflammatory response of the body that causes the blood pressure to be elevated, the heart rate to be elevated. And so if you are prone to have high blood pressure, in the office, or if you have white coat hypertension, that's something that actually is a positive stress test, what I call in my world, a positive stress test. That is, if you have, that means that if you are if you're exposed to any other stressful environment, which we all have, we all exposed to stress. I mean, stress is part of life, it's part of where we live, it's part of our life, right? So if you are prone to have high blood pressure in the doctor's office, more chances than not, you're probably gonna have high blood pressure response in other stressful environments as well. So now, I don't want you to ignore that high blood pressure. In fact, I want you to be more intentional about now finding out, how do I get to that point where I can get my blood pressure under normal range, even in the face of stress. So that's why we'll have to delve into measures that will help you to cope into stressful environments of that sort. That was the first question. The second question you asked was about, remind me again?
So how do we address that? Right. So,
Okay.
right. You know, you're going to be stressed at the doctor's office,
Yeah.
or even at home. People have anxiety with taking their blood pressure. So how do we kind of overcome that stressor?
Yes, yes. Great question. Again, I think, again, it's good that you mentioned having to check the blood pressure in different settings is important. The fact that your blood pressure is normal in this snapshot, maybe at home, and then you go to the doctor's office, it's elevated, it's good information, or vice versa. So you definitely want to check your blood pressure in different settings so that you have that level of that average blood pressure and not going on one reading. Okay, so once we know that, okay, you do have high blood pressure response in different settings, then now we start talking about, then what? How do we address that? Anxiety is part of our way of life. So definitely, this is where we dive into, okay, how do you control stress? How do you manage stress? And one of the ways that I tell people, first and foremost, is always be 1 or 2 steps ahead. Anticipate, planning. A lot of times we get anxiety because it's in the face of unknown. We don't know what's coming. We don't know what the next step is. So when you anticipate, when you plan, when you know what's coming, then you're more at ease, you're more comfortable. Now you're able to breathe, because what I always say to people, what's driving the stress is the mind, is the anxiety is the mind is here. Okay, the body is here, the mind is far ahead, trying to figure out, okay, what's going on, trying to figure things out. So what needs to happen is finding that way, that technique. Some people use yoga, meditation, ways to kind of now be present, be mindful, to be able to bring the body and the mind in alignment. Once you're able to do that, then you're able to be intentional about things that are going to help your body physiologically, like breathing, which is one thing that we don't constantly think about. That is so, we sometimes take it for granted that we're breathing, but it's very important part of blood pressure control, because the oxygen intake very intentionally through the deep breath and the deep long exhalation is really what helps physiologically to give the body what the body needs, that is the oxygen, and get rid of the carbon dioxide, which again bring about that balance physiologically and help us to be more at ease. And that state of easiness is really what we should be looking for. And that's gonna help to control our blood pressure, because our arteries are not stiff, our arteries are more relaxed. And so we're able to is able to receive the blood as the heart pumps into the artery, is able to receive the blood in the output, and such the blood pressure is lowered and at a level where it's in normal range. And so it takes time. It's not something that it's going, especially if you are somebody who's anxious, if you're somebody who are prone to really think far ahead, have your mind thinking about racing, thinking about so many things. It's not going to be easy to change overnight. But certainly, with having a plan in place that you're going to be able to implement consistently, you are able to do that and get your blood pressure control better, maybe not on 4 or 5 medications, maybe on 1 or 2 medications. So it's a combination of those things that will help.
Yeah, I mean, I think that it's important that we, like you mentioned, have that mindfulness piece in it, but also know and being able to prioritize self-care. I think a lot of times people misunderstand self-care and self-comfort. When I'm talking about self-care, it's about setting boundaries so that you can have nourishing meals, that you can add in therapeutic foods that help lower blood pressure. It's about prioritizing sleep, prioritizing you, and so you can reduce your stress and also have a better handle of it. When we're mindful of these strategies, we're able to be more effective in reaching our goals and lowering our blood pressure. But I think it's also really important that we understand the importance of nutrition when we talk about these 3 parameters, because there are certain aspects within nutrition that increases pulse, increases blood pressure, and it's not just about the foods we're avoiding, but really what are we adding into the diet that helps us relieve the tension that's in the arteries, but also the possible anxiety and stress based off of different vitamin and nutrients deficiencies. So I think it's also that collaborative approach of knowing, okay, well, if my blood pressure is high, you can be empowered to know the power of just lifestyle medicine and helping reduce it. There are many people who need medications to help, but it should always be coupled with nutrition, and know that there's also a part of the population that has resistant hypertension that doesn't respond to a cocktail of medications either. And so we need to look at that whole approach and kind of understand, well, why is it elevated? And making sure that you feel comfortable speaking with your practitioner about and troubleshooting what it might be. Because sometimes we kind of say, oh, I was just stressed in the office, it's not a big deal, and we don't think about it. But high blood pressure is a silent disease. That means it's silently doing damage to your arteries that can lead to a heart attack, a stroke, but also heart failure. It can lead to an enlargement of the heart. It can lead to a lot of issues that go silently until you feel a symptom, and then it's really hard to reverse it. So don't take high blood pressure lightly. We should all know our numbers, but we should also be testing it at home if it's ever been elevated and really optimize it, because that's an essential sign for good blood flow.
That's very important. I want to really reemphasize that point, that a lot of times people they know they have high blood pressure and they're taking high blood pressure medicines, and yet they're not at goal. They're not able to get the blood pressure to the goal that is recommended. Because if you're taking the high blood pressure medicines, you ought to at least make sure that you are getting to the range where it's not causing the damage, the end organ damage that we're talking about, that will lead to the kidney failure or the heart disease, the heart attack, and the heart failure, or even the stroke. And so definitely very important that you have your own, you have your own blood pressure measuring device that you're able to consistently at the same time. Every day, if you're going to measure it, it's best to do it at the same time, be consistent on what and when you check it, so that the numbers can be measured, can be comparable, right? And also, you don't want to check your blood pressure if you just came from running, or you just drank a cup of coffee, any of the stimulants, or you took over-the-counter medications like any of the decongestants. You don't want to be taking those and go ahead and check your blood pressure. Chances are your blood pressure are going to be elevated at that point as a result of those activities or taking those medications. So you want to make sure that you take the blood pressure consistently at the same time. After if you were especially even when you go to the doctor's office, you should walk into a doctor's office and then and then, go right in and check your blood pressure. A lot of times, again, especially if you walk to the doctor's office or you had a little bit of a walk, that can vary your blood pressure. So take the blood pressure sitting, feet planted, make sure you take it on the same arm at all time, and if you're taking it the first time, sometimes you may have to take it on both sides to see which one is the lower side, and that's the side that you stick with, and be consistent. Be consistent with it, and if it's still elevated, and you're taking the medications, you're properly taking the medications, then you need to get it addressed so that you can make sure that your blood pressure comes down to the normal range, because it has to happen. It has to happen. If it's not happening, you need to have that discussion with your doctor. Don't just go in there. I tell you so many times, patients come to my office and we take their blood pressure and they don't ask questions. And before they leave, I said, "What was your blood pressure?" They're like, "You took it. You should tell me. You should." Yeah, you're ready to leave.
Right.
So
You need to,
know.
you definitely should know your numbers, and you should know that everything that we need to look at the whole person approach to lowering blood pressure, right? It might be medication, but it needs to be nutrition. It needs to be stress. It needs to be sleep. It needs to be hydration. And one of the points that you've mentioned was, well, if you're taking caffeine, don't drink it. If you're taking decongestants, don't take your blood pressure. But if you are on consistent loads of caffeinated beverages, or if you're on consistent amounts of decongestions, we need to work on that, because that's going to be an elevation of your blood pressure. If you're taking Advil continuously, that's going to raise your blood pressure. And so while we say caution with it, that means that if you are somebody who is drinking a cup of coffee every hour and there's no time to take your blood pressure because you're not supposed to take it with caffeine, you need to titrate back that caffeine, because that can be a culprit. There's a lot of things that can increase blood pressure, and we need to do a full evaluation. So don't ignore the number. Don't assume that, oh, well, I'm in the office with the doctor, so it's high. Don't worry about it. I'll check it next year. That's too long. It can cause a lot of damage, and we need to make sure we're on top of all of our biometric numbers and really address them appropriately for optimal primary prevention of cardiovascular disease. This was a great talk. I'm glad that we were able to talk about all those vital signs. I hope this was helpful for everybody. And any last words of wisdom that you'd like to share with us? Dr. Corrielus.
I think it's great. I mean, this is a great start, great discussion about knowing your the vital signs. I mean, we walk around with our vital signs, and and you're talking about blood pressure being a silent killer. You could be walking around with a timing bomb and not even knowing. And so it's very important that you are aware, that you know your vital signs, that you know your blood pressure. Don't just say go into the office, just go into the routine of going to the office, doctor's office, and not knowing your numbers. Walk away knowing your numbers. And if it's not in good range, find out what is the plan. And you keep asking that question until you get to the normal range. And again, talking about an integrative approach to the blood pressure control. I cannot agree with you more. It's got to be integrated. We got to look at what are we putting into our body that's leading to the high blood pressure. That coffee that we take, a lot of times we think that, it's just, I like it, but it may not be liking it. Your body may not be liking it. Your heart may not be happy with you taking all that caffeine. Are you listening to your body? Are you listening to your heart? Are you checking your vital signs?
Definitely.
Those are some of the great points that you want to take away with.
Thank you so much. And to reach Dr. Corrielus, visit him at drcorrielus.com or his Instagram or Facebook at Dr. Corrielus. Thank you so much for your time today, and we'll talk again soon.
Fantastic. Thank you for having me.
Thanks.